My name is Charl Els and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine at the University of Alberta. This session offers a refresher on the commonly used definitions in occupational mental health. Thank you to the Workers' Compensation Board of Alberta for making funding available for this project. There are no conflicts of interest to declare. The opinions expressed in this presentation reflect those of the speaker and are not necessarily those of the collaborators or any funding agency. At the end of the session, participants will be equipped to define concepts like occupational capacity, risk, and tolerance, understand the difference between concepts of limitations and restrictions, and also describe what constitutes a safety-sensitive position, and looking at what are contraindications to such. What is impairment versus disability? The 6th edition of the Guides to the Evaluation of Permanent Impairment, published by the AMA in 2008, is one of the most commonly used sources of definitions for impairment and disability, and are used in the US as well as Canadian disability and compensation legislation schemes. The AMA defines impairment as an alteration of an individual's health status, a deviation from normal in a body part or organ system and its functioning. The World Health Organization defines impairment as any loss or abnormality of psychological, physiological, or anatomical structure or function. Disability is principally a legal concept defined in the language of legislation, jurisprudence, and insurance policies. The AMA defines disability as an alteration of an individual's capacity to meet personal, social, or occupational demands because of an impairment. The WHO defines disability as an activity limitation that creates a difficulty in performance, accomplishment, or completion of an activity in the manner or within the range considered normal for the particular person. What are the concepts risk, capacity, and tolerance? Well, the definitions offered in the AMA's 2005 text on A Physician's Guide to Return to Work and How to Think About Workability and Work Restrictions are as follow. Risk, it refers to the chance of harm to the patient or to the general public if the patient engages in specific work activities. Risk in this regard means the person should not do something even though he or she may actually be capable of doing the activity. Significant risk would justify work restrictions. Capacity, as per AMA definition, refers to the concepts such as strength, flexibility, and endurance, which can be objectively measured. A patient is physically able to perform the task in question while ignoring the symptoms. Current ability may increase with exercise or it may decrease with deconditioning. As per AMA, tolerance is described as a psychophysiological concept. It refers to the ability to tolerate sustained work or activity at a given level, and symptoms such as pain or fatigue are what limit the ability to do the tasks in question. The AMA text suggests that the patient may have the ability to do a certain task, in other words, there's no work limitation, but not the ability to do it comfortably. Tolerance is the ability to put up with the symptoms like pain and fatigue that accompany doing work tasks in order to gain the rewards of work, which include, of course, income, health benefits of work, self-esteem, etc. What are limitations and restrictions? Well, limitations are defined as something a person cannot do as a result of injury or illness. For example, after an injury to the quadriceps muscle, an individual may not have the strength to permit lifting a certain amount of weight using his or her legs. That is a limitation that results from a loss of capacity. Restrictions, defined as something a person should not do, as it may delay recovery, may cause injury or illness, or the illness may recur, or it may endanger that person or other people. For example, individuals with uncontrolled seizure disorders may incur risk when expected to work as commercial airline pilots or bus drivers. Or persons consuming cannabis may be at increased occupational risk due to the association with increased crash risk, and hence should not work in safety-sensitive settings. That's a restriction that's introduced based on an increased occupational risk. What is safety-sensitive work? Fan and co-workers suggest that a safety-sensitive or safety-critical task was previously defined to mean one where certain forms of personal impairment can put other people at risk. The concept of risk in this operational definition has been refined to include the risks both to the worker as well as to others, which may arise out of performance error due to physical or mental conditions, with consideration of the nature, magnitude, and immediacy of the risks. In its broadest sense, the category of safety-sensitive work includes work in which one or more safety-critical tasks are or may be performed, and where possible consequences of an error may include death or serious injury of a worker or a member of the general public, or alternatively damage to or serious disruption of equipment, production, or the environment. In safety-sensitive settings, the opportunities to mitigate harm arising from a worker's impairment may be limited, as adverse consequences usually follow very shortly after a performance error. In addition to safety-sensitive occupations, Fan and co-workers coined the term decision-critical workers, in whom impairment, including that related to substance use disorders, may impact occupational performance, relationships, attendance, reliability, and quality. In these so-called decision-critical workers, adverse consequences may not be immediately apparent, but that potential orbit of harm nevertheless exists. What are the contraindications to safety-sensitive work? Well, ongoing substance use, not including tobacco or nicotine or caffeine, in the presence of an active untreated substance use disorder or a history of substance use disorder. Certain psychotic disorders, example schizophrenia, personality disorders that would adversely impact occupational predictability or interpersonal functioning, imminent substantial risk of harm to self or others, any psychiatric disorder that results in intelligence that is not conducive to safe and predictable operational functioning, mood and anxiety disorders that result in increased risk or significantly decreased capacity, and this includes treatment-resistant conditions. Persons who, by their own choice, are not willing to adhere to occupational policy requirements that are in place for safe and predictable operations at work. What are accommodations? Well, accommodation and undue hardship are also separately defined. The purpose of accommodations to the point of undue hardship is to help maintain the worker's ability to remain at the workplace without work disruption, or to promote timely and safe transition back to full work productivity. Accommodation strategies typically should address mental health and related concerns, including more serious mental illnesses. Accommodations are intended to support productivity and performance, and they are considered cost-effective when looking at the savings incurred by keeping workers occupationally engaged and productive. It's important to use the correct definitions, and we've provided those for capacity, risk, and tolerance as per AMA literature, and also to understand the difference between limitations and restrictions. Safety-sensitive tasks and positions were defined as well, and they do require higher standards for mitigating risk and ensuring safety, as well as predictable occupational functioning. We've provided a list of contraindications. I've included a list of resources which may be helpful. I look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.